All right, good afternoon, everybody. Patrick Mellin here with Jaime Chaifetz. We are in the midst of the coronavirus pandemic, and here at Effectively Schizo, we wanted to give you guys an update and talk to a professional. We thought that would be helpful for everybody. So we're here with Dr. Kunam, and Jaime, do you want to start it off?
Yeah, sure. So we just have some questions for you. You are well, first, before I say what you are, you can tell us a little bit about yourself, your experience, your credentials, and whatnot.
Yeah, that would be great. Thank you so much for inviting me to do this. I'm always excited to talk about myself. I'm a board certified adult psychiatrist. So I went to medical school, and then after medical school, did 4 years of psychiatry training, where you can do it at the hospital or at psychiatric hospitals, regular hospitals, or traditional hospitals. I don't want to say regular hospitals, and then outpatient clinics and other things related to psychiatry. And then we also dabble in therapy. I currently practice in Michigan and California through telemedicine, actually. So it's kind of been interesting because I did this even before COVID started. And so I've been able to help others kind of transition. Mostly I've done some inpatient psychiatry consults, ER consults, OB-GYN consults, any kind of consult you can think of, and then outpatient clinic work for basically the whole age group subset. Mainly over 16, I try to stick with that, but with the access to child psychiatrists being so low, I do see children once in a while as well. And yeah.
That's awesome. What kind of excites you about the future of psychiatry? Do you have is there certain research or treatments that you find that are, really exciting and upcoming?
Yeah, I mean, I think actually even more than the science, which is great, and definitely we're getting some science-related updates, is the kind of breaking down the stigma, breaking down the fear of seeing, a therapist or a psychiatrist, because I feel like that's one of the biggest roadblocks to a lot of people that even walk into my door, which in itself is already a great thing that they've overcome to even walk into my door. But a lot of times I know it took them years to do it. And so this kind of, opening up the dialogue, to people talking about it, disclosing it, it's private info, but at least if people are talking about it, and they are more now, people are going to feel less ashamed, less fearful. And then also I really want celebrity reach is astronomical, when we talk about it. And so lately there's been a lot of people disclosing about bipolar, which has a pretty big stigma, and people use that word in a very derogatory way. So I'm really excited about kind of the approach we're using for breaking down stigma.
That's that's music to our ears. That's certainly one of the things, one of the projects, the targets of our project is opening up the language and talking about it. And like you said, the social stigma that we deal with is really, really important to us.
Yeah, so I guess I would like to talk more about that also, but then we have some questions about, I know a lot of people who follow us and who I'm sure your followers as well are concerned about, COVID-19, the pandemic happening right now. So, how are you dealing with it? How have your, I don't know, with whatever you're able to say, how your patients been dealing with it? Have there any changes you've made during the pandemic?
Yeah, of course. Obviously I can't go into super detail because of HIPAA, but in a general, way, I can talk about in general, a lot of my patients, they're doing okay. I think some of it is that there's at least some reassurance that they're getting their medications. They're able to do, the 30-day, the 90-day refills, even the injections that they have to get at the long-acting. Our clinic and a lot of clinics that have a lot of patients with long-acting injections, we're still doing staggered appointments so they can come in or wait in the car, and the medical assistant or nurse can come out and give the injection, or they can come into the clinic. So I think though it's a very big change, and definitely there's an increase in some symptoms. I think also, luckily, we haven't seen, or at least I haven't with my patients, anything going on with medications running out, which was like a big fear. And then being able to still access, their psychiatrists and therapists, which, with telemedicine, I think a lot of people have been able to still access, even though I know in general, there's still very low access to mental health care. But I think at least now, there hasn't been hopefully too big of a change. I think for the people that I'm probably not hearing from yet are the ones that don't have access to internet and don't have access to like a stable phone line. And they're the ones that, are, at least there's still some in-person clinics that are open, that are staggering appointments to make sure to address their needs, especially like the homeless and the VA system, that sort of thing. I'm trying to think, and I feel like I got off topic a little bit, but the two symptoms I've been hearing a lot in general from all my patients is sleep problems and anxiety. So people that have had their anxiety in remission for sometimes months or years, and maybe even didn't have to take a medication for anxiety, or maybe as many medications, they are coming back and saying, I think I need that extra medication for anxiety or sleep right now, even though I know I don't really need it usually. So it's pretty much affecting everybody, but luckily so far I haven't seen a lot of negativity yet.
That's good. I know a lot of people are talking about like what the world is going to kind of look like after the pandemic, and like how, people that, like you said, people who have been in remission for years might need medication now. I'm just like thinking that a lot of people who didn't have previous mental health issues are going to be affected by this as well. It's really just a difficult time for a lot of people mentally. So yeah, it's just hopefully, I mean, when we come out to the other end of this, do you think that it's going to be, how different do you think it's going to be?
I mean, that's a really good point. I didn't even really, I guess, completely think about fully, but I guess in some ways it's great that my patients that already have access, like they kind of already know, like, okay, they have a support system, they know where to go to, but there's going to be all these people that are going to develop symptoms and have never had to reach out, and they're going to be the ones that it may be really tough for them because they've never had a mental illness before, or any symptoms, or had to seek out treatment. And so maybe, really just, I think one of the good things is kind of bringing the information to light, making it very apparent, which I've been seeing news channels, talk about mental health during this time, and so that everyone knows what they can do, for those symptoms.
Yeah, that really, that resonates as well. I was working with a group last night of people living with a mental illness, and we talked about resiliency, and how in some ways we find that we are better prepared almost for some of these symptoms than other people. We have, because we now have the toolbox, we have the language, we have the coping mechanisms that we've been practicing for so long. And people who are just now experiencing these spikes in anxiety that they haven't had to deal with before, that's like, it's a whole new kind of bag for them.
Yeah, and I think that's, that's definitely something that I want to be able to kind of convey through, social media and internet posts and Facebook groups and whatever I can, and like news channels and whatnot, that because there's this new reality for everybody, they're going to need to use new coping skills. And like you said, many people just never really had to change their coping skills. They were doing perfectly fine with whatever set they had. And now they have to actively think about, using new ones. And they probably have no idea where to even look, or may not even be insightful enough to understand that they need to start using different coping skills.
Yeah, so it's really a very challenging time and a trying time for many. So in terms of daily life and social distancing, do you have any tips or tricks that people have been successful with, like navigating this time to kind of stay healthy and stay positive?
Yeah, I think for the most part, what I kind of tell my patients, or I tell people that have reached to me newly, is really kind of figuring out ways to create new spaces within where they're living, because it's a whole new thing for them to be spending 24 hours in one place. And then also, and kind of creating boundaries, not just like physical boundaries, like this is where I'm going to do my work from home, this is where I'm going to sleep, this is whatever, but then like social boundaries where, okay, I've got my mother-in-law in one room who happened to be visiting and now cannot leave. And I have, you know, my multiple children. And then I have my husband who normally I only spend like 3 hours a day with. So, you know, it's something, so a lot of social boundaries of, okay, I need space from this, I need time away from this, and still and creating that as well. And then, and sleep and physical exercise. So not, you know, even if we tend to be sort of sedentary people, we're probably doing a lot less than we were even before. So, you know, we're not walking around, we're not walking to even our car or from the parking lot to our work, or, you know, all the things that we were doing before. And so to really increase the amount of physical activity so that we can sleep better.
Yeah, definitely. So there's some, I mean, I don't know if I'm sure you've been looking at social media, everyone is these days. There are some happy forms of it going around. For example, John Krasinski from The Office has some SGN, some Good News Network, where he talks about, you know, positive things in the world. Do you have any positive outlets that you would like to talk about or share with the world?
Yeah, I mean, I think humor and laughter is truly a very good medicine. And I think though obviously we never want to use it so excessively that we're totally ignoring a problem forever, it's a great way to boost mood, you know, throughout the day. I have not checked that out yet, but I will now, because I do love The Office, and I'm probably old enough where I really appreciated Office in its original form. I heard that like a lot of younger people are into it again, and that there's this new kind of craze with the teenagers that they just like watch it, like binge watch it. So I'll have to check it out. But I think any type of humor that, you know, people are interested in, that they love to turn to, those whatever comedy shows that they're, you know, playing, and if they can follow their favorite comedians, I'm sure they're going to be posting a lot, because they're home too, bored. So I've noticed like a lot of them are posting a lot more things, you know, and doing things live. So and then also just, you know, spending time with family and friends and being able to laugh and enjoy you know, memories, good memories, and that sort of thing.
I know that I love late night show monologues.
Mm-hmm.
And in the past week and a half or so, all the late night show hosts have started their own, you know, a late show from home, or a version of the late show. So that's been helpful as well. You know, we say humor is healthy.
Right. Yeah, definitely. Mm-hmm.
So we talked a little bit about social rhythm therapy, and I'm honestly not too familiar with this, as well as I feel like Patrick, we haven't heard of it before. So what can you explain what it is to our viewers, and how it's helped your patients?
Yeah, so it was kind of it targets particularly bipolar symptoms. So if someone is, you know, diagnosed with schizoaffective with bipolar type, then this can be really helpful. But I think it's really can broadly apply it to anybody. I mean, even if you don't have a mental illness or you know, any kind of symptoms, I think it's still helpful to keep in mind, especially in times of stress like we are in now collectively. So I'll go over a little bit about it. So social rhythm therapy, it's actually evidence-based. So they've done studies where they show, like, when you have somebody participating in this type of treatment, this therapy treatment that's non-medicated related, they actually improve over the people that did not participate in it. And so it has some clear-cut results. I would recommend in general for, you know, I would say most doctors would recommend that, even though we do say, hey, non-medication therapy is important for schizoaffective and bipolar disorder, they also should already kind of be on a medication regimen or under treatment with a psychiatrist while engaging in the therapy that's not related to medication, just to make sure that the symptoms are well controlled, and that or avoiding, an episode again. So this basically emphasizes like daily routines, how to kind of be aware of how our mood is affected by our daily routines. And daily routine sounds pretty simple. We learn from a young age, you wake up, you brush your teeth, and you go through the day and you have a routine. But the problem comes into when suddenly our routine is a little bit out of our control. We might have a job that has shifts and different timings. It might be night shift one time, and then later on for a few days is a day shift. And these are the kind of things that social rhythm therapy kind of helps us understand that these are things that might be risk factors for someone having another episode, whether it's manic or depressive episode in schizoaffective bipolar or bipolar 1 or bipolar 2. And so just really being mindful, kind of figuring out where we can reduce the variability in the schedule and make it a little bit more consistent, making sure they have enough sleep, eating appropriate meals, like what is helpful. It doesn't have to be 3 large meals. It doesn't have to be super traditional, but what works best for the person. And that's why it's good to have a therapist, because you can really work on this for a period of weeks to really pinpoint what's best, what works best for that particular person. And so for some people, they do have to make a change in their job or a change in their career sometimes, because they realize it's really a big risk factor for them. And they appreciate that they want to be able to stay symptom-free, or at least stave off their next episode and make this change. So I think we talked about, reorganizing kind of the rhythm of the day, implementing the new one, and that takes time. Obviously, new habits take time. This is actually probably a good opportunity during COVID to make a change, because we're kind of forced to be in this situation, but hopefully it's towards a good change, rather than it being bad. And then eventually at the end of treatment with the therapist, you would slowly kind of maybe see them less frequently and be able to just continue maintenance of this new kind of schedule that you've created. And so, the goals of it would be to hopefully have at least less severe episodes, or to delay episodes of mania or psychosis with mania or depression, and basically improve kind of happiness, contentment at work, doing well at work, doing well at home, relationships, everything improves when you're keeping the symptoms in control.
Great, that was really interesting. We said we hadn't heard of it before, and it sounds like a great tool to get the hang of it. So we started to talk about language a little bit, and our show is effectively schizo. So I was wondering if you could give us the difference between schizophrenia and schizoaffective disorder,
Sure.
what they look like a little bit.
Yeah, of course. So definitely, I would say schizophrenia is probably the more commonly known term, and people will use it very, generically for many different things. But schizophrenia is what is an illness where the symptoms or the episodes tend to be more losing touch with reality, having psychosis. So it will be like hallucinations that are auditory or visual, or having paranoia, delusions that are of paranoia, or delusions that not necessarily paranoia, but they're just delusions about, something going on that's bizarre, that's not possible in reality. And then they could also have disorganized thinking. So they're basically, they're saying things, but it's not very logical. And these are all part of what we call the psychotic episode. They're in schizophrenia, they're not usually related to a mood episode. So you don't have to necessarily have depression. You don't necessarily have to have bipolar mania or any kind of mood episode for this to come on. It comes on independently, or maybe it's triggered by something, but it's not a mood disorder or a mood episode. And then when you start seeing that once in a while, for someone to suddenly then be diagnosed schizophrenia, but then they're thinking, hey, it might be schizoaffective actually, is when they start maybe having a depressive episode at some point in their life. You can still be schizophrenia, and it's like have a schizophrenia diagnosis and have maybe one episode of depression or two in your life. But once you start seeing that the mood symptoms are more common than the psychotic episodes, or they're kind of not really, the psychotic episodes aren't really that independent, let's say, or very few times it's independent, then you can say schizoaffective, because you're saying, okay, most of the time there's a depressive episode or a manic episode that's happening first, and then the psychosis is kind of based off of that. I mean, they could be happening at the same time, but basically that's what's kind of causing it or making it worse. And so that's kind of the main difference. The treatment for it is fairly similar in the sense you're still gonna, when you first see somebody come to you for help and they're having psychotic symptoms, you're going to use an antipsychotic, first generation or second generation. But with schizoaffective, because there's probably a mood disorder involved with it, you're going to be more likely to maybe pick a atypical or second generation, because they tend to have more mood stabilizing properties. That being said, again, everyone is an individual, so a lot of times it's just seeing what works best for the individual based on the symptoms, their goals, and that sort of thing, their age, their medical conditions. So, but for the most part, with schizoaffective, we're going to target mood symptoms as well. So you're going to pick a mood stabilizer, maybe like lithium or Depakote, or an atypical like Seroquel, olanzapine, something like that, to control the symptoms.
It's very interesting. Yeah, when I was first diagnosed with schizoaffective, I was like, what is that? I've never heard of it. I didn't know what, it was obviously a very confusing time in general, but it was a confusing diagnosis as well. But over time, with more people who come out and talk about it, especially I don't know if you've heard of Ellen Sachs or Eleanor Longden, but they're two kind of like popular, they've done TED Talks, but they both have schizophrenia. And the more, like we were saying earlier, the more people that talk about it, the more it can bring awareness and people can feel more comfortable with themselves. So it's great that you're doing these studies and working with people and stuff like that. So are there certain risk factors that make someone more likely to experience these type of symptoms than other people?
Yeah, so that's a great question, because there's a lot of things that have kind of changed in the last few decades that make us have to kind of change how we ask questions and how we evaluate people that maybe come to the ER and are having these symptoms and we're not sure what it's from. So definitely there's a big genetic component to it. There's a lot of studies that have shown that if you have a first degree family member or even second degree, there's certain percentages of likelihood. It doesn't mean for sure 100% in any way, shape, or form, but it just means the risk is higher, to be mindful of it, to avoid extra risk factors so you're not doubling up on risk factors and that sort of thing. And so genetic is something there that we can't really change. We hope one day maybe we can change that. Those are the kind of things that hopefully science can kind of in the near future, hopefully even be able to affect in a positive way. And then the other risk factors that are a little bit newer is actually psychoactive substances. So there was a time when marijuana and cannabis was relatively mild, natural, not bred in a way to create a higher amount of THC or that sort of thing. But now in the last, at least 10 years, we've definitely seen, strains that are very high in THC, and THC is known to be something that aggravates psychosis. And so if you already have a genetic component, then you may notice that you're to get your first psychotic episode while you're using something with THC. Or you may notice every time you use something, that's the only time you're getting a psychotic episode, whereas someone next to you who doesn't have a genetic predisposition, they may never get psychotic on the same amount of THC. So that's something that we have been focused on lately, because it's become very supposedly innocuous, supposedly natural, legal, so many things about it that are said in media about it being safe compared to so many other, medications. But the truth is, they're not that safe. That any psychoactive medication is not necessarily safe. You have to know there's definitely risks with it.
Yeah, definitely. And then we have just one more question about like affective schizophrenia. Are there more common treatments that you found to be effective, medicinal and non-medicinal treatments?
Yeah, so I mean, when it comes to medications, definitely an antipsychotic of some kind. The first generation are commonly like the common names you might hear, like Haldol and paliperidone, or so Haldol or Thorazine. Those are probably the more common ones that you'll hear. Then there's the atypicals, which are considered to have less of the movement side effects, but they tend to have more of the metabolic side effects, like pre-diabetes or weight gain. And those are like what you would commonly hear as Seroquel, Safras, Latuda, Risperidone, Zyprexa, yeah, Geodon. Okay, so those, and then when it comes to the mood stabilizers, we're talking about lithium, Depakote, and then the atypicals also seem to have mood stabilizing properties. So sometimes we don't need a mood stabilizer if the symptoms are being effectively controlled by the atypical. And for some, the mood stabilizer is great for protecting against mania, but the depression really needs an antidepressant. So though we always say be very cautious with the antidepressant in someone that might have bipolar or bipolar schizoaffective, we still use it frequently because the depression can be so severe after the manic episode, and the only thing that helps is an antidepressant. We just have to always make sure it's prescribed at the same time as a mood stabilizer or an atypical antipsychotic. And when it comes to non-medications, definitely things like proper nutrition, social support. So starting with physical things, definitely exercise, not smoking cigarettes. And that's a twofold thing where one, the cigarettes kind of, mess with your nervous system with the nicotine, but two, it actually affects the metabolism of medications. So a lot of times it makes the medication get out of your system quicker, and a lot of people notice it, and that's why they kind of feel like they liked using it even though they don't really particularly like to smoke, because they notice like they don't have as much side effects from the medication, but that's because the medication is not really working and doing what it needs to do. So, but physically, not smoking nicotine, not smoking, not smoking cigarettes, and not smoking marijuana, because even if the product says it's less THC and more CBD, we just don't have any way of like testing it in a way that we know for sure that it's what they're claiming it to be. So a lot of times when they do independent testing, there's definitely more THC than they claim there is. So we just don't have like quality products yet that we know for sure. There might be some that are very expensive that tend to, pass the test well, but they tend to be very expensive. So, so I still recommend avoiding any kind of cannabis related product. And then socially, having a good social system, as whatever it is, like even if it's not family, it's, friends or peer-to-peer therapy. So like NAMI, the organization, NAMI, like NAMI.org, they have a website that where you can look up and find out who nearby has, a support group or peer-to-peer therapy group where you can have basically a support system outside of home. And then having a job and pursuing goals and continuing with trying to obtain your education. Those are all really good goals to keep in mind. Obviously, they need to be scaled back sometimes, but they need to be scaled back because maybe the episode is very severe. We need time to, recover, but to still have those goals in mind. Yeah, so I think support system and medications, and then physical health.
Oh, great. Well, thank you for all that information. That was really great. Thank you for spending some time with us today. Is there anything you'd like to tell our viewers before we sign off today?
Just that, I always want to encourage everybody to know that, this is something that these illnesses are very common. People don't talk about it that much, but, we know as healthcare professionals, that there's a lot of people around that have it. You never know have it, or, they're functioning well, they're meeting their goals, they're having, relationships and children. So it doesn't necessarily really stop you from having those dreams, and to just get on the right treatment with the right doctor. Sometimes the personalities don't match up, but if you can find a good therapist and doctor that can work with you, that's really important.
Great. Well, thank you so much again. Hopefully we'll check in again with you sometime soon to see how things are progressing so far.